Despite our best efforts to keep vaccines safe and ready to use, many parents continue to have some common concerns which have increased over the past decade. The most prevalent concern is a nonspecific belief that children are given too many vaccines too soon and that this is somehow bad for children or their immune systems. As a result, some parents use alternative schedules to vaccinate their kids, delaying or eliminating doses of vaccine. Some parents also worry that vaccines are an unnecessary risk because their children are unlikely to get exposed to the diseases. Autism is another common concern. The autism link was originally raised in 1998 by British physician Andrew Wakefield, and it was widely communicated to parents by activists like Jenny McCarthy, an actress and mother of an autistic child. Media attention seems to have peaked in 2010 as studies which raised the question of autism and vaccines in the first place were discredited. Now let's look at some of the vaccine safety systems to address these concerns. It seems like there are so many vaccines, and for good reason. Some vaccines are important during the first months and years of life because that is when a child is most likely to have serious complications from the disease. For example, an infant that catches hepatitis B at birth is likely to have chronic hepatitis symptoms for his or her whole life and has a good chance of dying from hepatitis-related complications, where an adult is likely to get better after initially getting sick with hepatitis. A study in Germany in early 2011 examined over 13,000 kids to see if vaccines caused immune system problems, allowing other infections to make children sick or causing allergies, asthma, or ADHD. The study showed no increase in these problems in the vaccinated population, but the unvaccinated population caught 3 times the amount of vaccine-preventable diseases when compared to the vaccinated group. This study also illustrated one of the difficulties of studying unvaccinated children. There are very few of them. Out of the 13,000 children in the study population, less than 100 were unvaccinated. Here's another important perspective for parents who worry that their child is getting too many vaccines too soon. Vaccines have been greatly refined during recent decades. The current regimen that protects against many diseases has about 1/10 of the number of antigens compared to the U.S. regimen in 1960 or even 1980. In 1980, there were over 3,000 antigens in the U.S. vaccination regimen compared to less than 150 antigens in 2000. It's also important to note that smallpox and wholesale pertussis vaccines are no longer used in the current regimen. In spite of these evidences, some parents decide to use alternative schedules where they delay or omit vaccinations to decrease the number of vaccinations. While the CDC schedule has been studied, alternative schedules are not validated and therefore are experimental. In fact, the current standard of effective care is to give vaccines on the CDC schedule. A parent who changes the schedule should sign off on a refusal to vaccinate form, like the one the AAP offers on their website, to provide documentation that the change was made by the parent. This is similar to when someone signs out of the hospital against medical advice. This is important because when parents change the schedule, they increase the likelihood that their child will get sick from a vaccine-preventable disease. However, the AAP and CDC do not support a doctor's office firing a patient whose parents avoid or delay vaccines. It is more important for that child to have a pediatrician than to draw a line in the sand over vaccines. In addition to signing a refusal to vaccinate, parents who delay or avoid vaccinations for their children should be aware of the responsibilities. Schools and other group settings need to know the child is not vaccinated so they can let the parent know if a possible exposure means the child needs to stay home. With measles, for example, unvaccinated children should stay home for 3 weeks to make sure they are not catching the infection and passing it on to vulnerable people. Additionally, for sick visits to urgent cares or other doctors, the parent should let the doctor know the child is not vaccinated since doctors may be unused to seeing some vaccine-preventable diseases. Parents should also know that people who have been exposed to infections can often spread those infections before they feel ill. Some people are contagious even though they never get symptoms at all. And in the case of an outbreak, parents should know that their child can still get vaccinated. It's not too late. Some parents think certain diseases pose little risk to their child because vaccination has decreased the likelihood of exposure. But some germs like tetanus, pneumococcus, and Hib don't ever go away, and they can always infect a child. And other diseases like polio and measles, while less common, are only a plane ride away. Uncommon diseases will also become more common if vaccination rates decrease. History has shown that diseases surge when given the opportunity. We already discussed the increase of diphtheria in Russia in the early 1990s among adults who lacked booster shots. In the U.S., a shortage of Hib vaccine in 2009 also led to an increased rate of invasive Hib cases. Many European measles rates also rose during the past decade after Andrew Wakefield's allegation that MMR vaccines caused autism. The only disease that's truly eradicated today is smallpox. Autism continues to be a very big concern. Some parents have heard that autism is caused by vaccines, and there were two main theories linking autism to vaccines. The first theory was the MMR vaccine caused autism. This theory was first published by British Dr. Andrew Wakefield in a case series in 1998 reviewing a dozen children with autism. The theory seemed plausible to many parents because autism is often diagnosed at or just after the age when the MMR vaccine is typically given. Since then, Wakefield's study has been retracted by the journal that published it and disavowed by most of its authors. An investigation in 2010 also found it to be not just misguided, but fraudulent. However, despite the lack of support among experts, a few parents still fear that MMR vaccines cause autism. The second theory was that autism is mercury poisoning, and the mercury came from preservatives in vaccines. This theory lost a lot of ground when mercury was removed from all childhood vaccines except multi-dose flu vaccine in the year 2000, and yet autism rates continued to rise between 2000 to 2010. There have been scores of studies trying to link autism to vaccines over the past decade, but researchers have been unable to find a link. Autism is often diagnosed after 18 months of age when symptoms become more apparent. In one study, a group of autism diagnosticians were shown videos of infants and 1-year-olds. The doctors were not told which children had autism, but they were able to correctly identify which children had autism from behaviors seen in the videos, even though it was before their MMR vaccines. Additionally, the first trimester is when babies' brains develop. About 50 years ago, prenatal exposure to thalidomide during the first trimester of pregnancy correlated with a large increase in autistic babies. This indicates that autism spectrum disorders begin well before the baby is born. In 2011, another study also found that babies with autism are born with excessive connections in the prefrontal lobe, another sign that autism begins well before vaccination. As the body of studies trying to link autism grows larger, the case that vaccines cause autism gets weaker and weaker. Autism spectrum disorders occur as high as one child out of every 100, but despite high rates, the connection doesn't show up in studies. Some parents say they are convinced, not by the scientific studies, but by a gut instinct or intuition they have. The purpose of science is to double-check and validate these feelings so they don't mislead us. It can be very difficult to persuade a parent with facts when they feel that vaccines can cause autism. Some parents will never vaccinate, but most are very open to hearing what their child's clinicians think. Our next slide has some tips for talking to parents with concerns. To ease parents' concerns, all parents should get VIS sheets and aftercare instruction sheets. Also, plan on having some extra resources available for parents with concerns about vaccine safety. Have someone in your office brush up on vaccine safety issues and results of studies which have addressed vaccine safety. Resources presented at the end of this presentation will be helpful for learning about vaccine safety. Your vaccine safety expert can then help counsel parents with concerns. While some offices find it more economical to have non-provider staff counsel parents about vaccine safety, many concerned parents also want to know what their provider thinks. Note that coding changes now allow for staff at an RN level or higher to bill for vaccine counseling on a per component basis, although if your practice provides VFC vaccine, which is provided at no cost by the federal government, the amount for VFC vaccine is capped in Ohio's region at about $15. Additionally, the National Association of County and City Health Officials endorses the CASE method for counseling parents about safety concerns to gain the parents' trust before giving advice about vaccines. The CASE method has 4 steps. Step 1. Cooperate with the parent about the common ground you share. Both provider and parent want to do what's best for the child's health. Step 2. About me. Establish your credentials with regard to vaccine safety and let the parent know you've studied up on the issue. Many concerned parents are extremely knowledgeable about the details of certain safety studies, although they may not have all the facts. Parents do not like to come away from a meeting with their clinician feeling like they know more about vaccines than their clinician does. About me is also about establishing your sincerity. If you have children of your own and vaccinate them or give vaccine advice to your family, let the parent know about it. Step 3. Science. Make sure you are up to date on the science of vaccine safety. Provide the parent with information about the science behind vaccine safety appropriate to the parent's level of understanding and their need for information. Stick to proven points, which can be backed up with well-designed studies. Step 4. Explain and advise. Having established a connection with the parent and explained the science, make a recommendation to the parent about the decision to vaccinate. Parents put a lot of stock in their clinician's advice, and it's important that you tell them what you think they should do in a clear and respectful manner. It may also ease concerns to know that in addition to the phased drug trials performed for the FDA before vaccines are approved, the U.S. has 3 systems to monitor vaccine safety on an ongoing basis. The Vaccine Adverse Event Reporting System, called VAERS, is an open channel for anyone to report a problem about getting a vaccine. The VAERS system is monitored for patterns of complaints as an early warning system. Since anyone can submit a VAERS complaint, VAERS data cannot show the cause of a specific event, but it helps officials know where to look for problems. The Vaccine Safety Data Link is a huge database which tracks several health and insurance systems for correlations. It functions as a warning system like VAERS. For example, if a certain vaccine is followed by a lot of ER and urgent care visits, a red flag would be raised for further investigation. The Clinical Immunization Safety Assessment Network is an organization of 6 major medical centers that conduct research into the specific susceptibilities some people have to vaccines. CISA researchers try to understand why certain people have adverse events, and eventually to predict who will be most likely to have an adverse event after getting a vaccine.